Gastric Xanthelasma. Xanthelasma is a yellowish deposit of cholesterol associated with hyperlipidemia, and may present as an asymmetric or benign endoscopic finding in the stomach ulcers or gastric xanthoma. In stomachs it is used interchangeably with a number of asystolic and diastolic markers as well as with a variety of other institutions, but not all of them are associated with hyperlipid semia, for example ulcerative colitis. Gastric Xanthelasma is common in malignant stomach diseases such as ulcerative colitis, stomach ulcers and gastric xanthoma, but it is also present as an asymmetric or benign endoscopic finding in the stomach of some patients, characterized by a rare finding of yellowish cholesterol deposits on the surface of the abdominal wall. Here we report the results of a clinical study with 4 patients, one of whom was hospitalized and another whose abdominal pain was diagnosed as Xanthelasma Xanthomas during histological examination. More than half of the patients had abnormal histological findings and half of the cases showed signs of ulceration due to the patient's history and histology. Gastric xanthoma was characterized in 9 to 12 cases and clinical follow-up for treatment of ulcerative colitis in patients with xanthelasma was shown to be warranted. Gastric Xanthomas. Compounding of excessive cholesterol is believed to be the most common cause of gastric xanthoma in patients with ulcerative colitis and is observed in about 1.5% of patients in the United States. Stomach RBs with occurrences between 0.2% and 7%, while the detection of LGS is unusual, 0 to 0.2% and 0 to 3%. Lipid islets were also found in bile reflux-induced changes after a partial gastric rectomy. Cutaneous Xanthoma is a benign lesion of the gastrointestinal tract characterized by lipid, which contains foaming cells. The phagocytosis of H. pylori bacteria can trigger the formation of foam cells that penetrate the lamina and cause gastric xanthelasma. In the stomach, xanthelasma and xanthoma are interchangeably used and refer to asymmetric benign endoscopic findings. Therefore, thorough examinations and follow-up examinations of the patient are imperative to search for such lesions. Xanthelasma, xanthomatosis or xanthomatosis is a benign, asymptomatic lesion that is found randomly in the gastrointestinal tract. It can be seen on the upper gastrointestinal examination, and is likely to be noticed in patients with abdominal pain, nausea, vomiting, diarrhea, abdominal cramps and vomiting. The common prevalence of gastric xanthelasma. Gastric Xanthoma (GX) has been observed in more than 1.5 million patients in the United States and Canada. In 14% of these cases, gastric xanthelasma is caused by the presence of a benign asymptomatic lesion such as ulcerative colitis or colorectal cancer. Upper gastrointestinal endoscopy shows the presence of gastric xanthelasma with a diameter of 1.5 mm to 2 mm. In addition, GX has good, marked single or multiple nodules or plaques, which range in diameter from 1 to 10 mm. Histopathological examination shows signs of chronic gastritis, including calyx cells with several foaming macrophages. The cause of anemia has been investigated in a number of patients with gastric xanthelasma and other gastrointestinal diseases such as ulcerative colitis, colorectal cancer, bowel ulcers and gastroenteritis. The presence of single or multiple nodules or plaques with a diameter of 1.5 mm to 2 mm makes this a common symptom of gastronomy and a possible cause of gastric anemia. Gastric Xanthelasma under the microscope. Histological examination of the gastric biopsy sample shows the presence of several nodules with a diameter of 1.5 mm to 2 mm. Interestingly, esophageal gastroduodenoscopy shows random results, including a 1 cm long pedunculated gastric polyps and a single oval-shaped nodule of 0.7 cm. The fundus indicates a mucosal lamina propria, which contains oval-shaped cells with several foaming macrophages. Results: histopathological examination of the lesion shows dense aggregates of foaming histiocytes that widen the lamina propria. Xanthelasma lipid islets are large, foaming macrophages that appear on the surface of the xanthoma and appear as single and rarely as several. Clinically, it is usually associated with a large number of symptoms that are not causally related to xanthomas. In cutaneous xanthomas we have found no evidence that there is a stomach infection that is directly related to the disturbed lipid profile. For a more clinical viewpoint and aspect to xanthomas and xanthelasma as a whole, then go to xanthelasmatreatment.com or xanthel.com.